All right, let's dive into a medical mystery that affects billions, literally billions, of people around the globe. We're going to crack the case of anemia, and you'll see the clues are hiding right there in plain sight. You ever have those days where you just feel tired for no reason at all, like completely wiped out, even when you got plenty of sleep? Well, that feeling, it could be a lot of things, sure, but for millions of people, it's the very first hint that something's not quite right inside their own bloodstream.
Okay, so these things aren't just random. Think of them as distress signals your body is sending out. Getting tired super easily, feeling breathless just from walking up a flight of stairs. Maybe your heart feels like it's racing, you get dizzy, or people tell you you look a little pale. Every single one of those is a piece of the puzzle, and when they start showing up, well, that's when the real investigation kicks off.
And just like any good detective story, you can't solve a case without some hard evidence. So where do we go first? The lab, of course. The first, and honestly, the most critical piece of evidence we're looking for comes from a simple blood count. This is where we find our first big lead.
So, what are we actually looking for in that blood count? Well, the clinical definition of anemia is pretty straightforward. It's when your hemoglobin concentration drops below a certain level. Now, hemoglobin, that's the super important protein in your red blood cells that's responsible for carrying oxygen all around your body. When those levels get low, your whole oxygen supply chain gets messed up. And that's exactly why you start feeling so tired and breathless.
But here's something really interesting. Normal isn't just one magic number. The baseline for what's considered healthy hemoglobin actually changes depending on your age and sex. So for an adult man, the cutoff is 13 grams per deciliter. But for a pregnant woman, it's actually lower, around 11. Doctors use these very specific targets to figure out if anemia is officially on the table.
And trust me, this is not a rare thing. To really get a sense of how big this mystery is, get this. In some developing countries, more than 50%, that's 1 in 2, of all pregnant women are anemic. That just blows my mind. It takes it from being just a personal health problem to a massive global public health crisis.
So getting that anemia diagnosis, it's kind of like finding the first footprint at a crime scene. Yeah, it tells you something happened, but it doesn't tell you who did it or why. To figure that out, we've got to dig deeper. It's time to get out the microscope and take a really close look at the evidence, the red blood cells themselves. And this is where we find our next huge clue, the size of the red blood cells. Are they microcytic, which just means smaller than usual? Are they normocytic, so normal size? Or are they macrocytic, bigger than they're supposed to be? Answering that one question is absolutely critical because it sends our investigation down 3 very different paths.
So take a look at this. This is what a lab tech is staring at. To us, it might just look like a bunch of red dots, right? But to a trained professional, this blood film is like a detailed clue sheet. They're not just looking at size, they're looking at shape, at color. For example, if the cells look kind of pale in the middle, that might scream iron deficiency. Every little variation helps them build a profile of the culprit. All right, so we've gathered our evidence. We have the low hemoglobin level, and now we know the size of the red blood cells. It's time to start connecting the dots. Let's line up the usual suspects. When you boil it all down, there are really only 3 main ways a person becomes anemic. I like to think of it like a factory that makes red blood cells. So, problem 1, you're losing your product faster than you can make it. That's blood loss. Problem 2, the factory's production line is just too slow, or maybe it's broken. That's decreased production. Or problem 3, the product itself is faulty and it's getting destroyed way too early. That's increased destruction. Okay, so let's follow that first trail of evidence. What if the lab reports that the red blood cells are small and pale, the microcytic ones? Well, that specific clue lets us zoom in on a much shorter list of suspects.
And suspect number 1, by a long shot, is almost always an iron deficiency. It is the single most common cause of anemia on the planet. See, iron is a crucial building block for hemoglobin. If you don't have enough of it, your body just can't make normal-sized red blood cells. Simple as that. Of course, there are other possibilities like inherited conditions, think thalassemia, or just the general wear and tear of a long-term chronic illness. But what happens if the cells look totally normal? At least in size. This is our second major clue, normocytic anemia. You might think a normal-looking cell is a dead end, but nope, it actually points us to a completely different gang of culprits. With this clue, we might be dealing with sudden, acute blood loss, where the body just hasn't had a chance to react yet.
It could also be that anemia of chronic disease again, where something like HIV is slowing down the bone marrow. Or it could be something called a hemolytic anemia, which is basically when the body's own immune system goes rogue and starts destroying its own red blood cells way too fast. And that brings us to our third and final major clue from the lab: macrocytic cells. These are the red blood cells that are way too big. It's a really distinctive look, and it points our investigation to a whole other group of suspects, usually ones that mess with how cells develop in the first place. When you see these big cells, the prime suspects are almost always deficiencies in a couple of key vitamins: folate, also known as folic acid, and vitamin B12. You need those to make DNA. Without them, the cells can't divide the right way, so they just keep growing and end up oversized and pretty useless. Other big factors? Liver disease is a common one, and so is chronic alcoholism, both of which just throw a wrench in the body's whole metabolic system. So we've looked at the clues and we've lined up the culprits. But to really solve this mystery, you have to look at the environment, right? The scene of the crime. And when it comes to anemia, the situation gets way, way more complicated when we look at tropical regions. I mean, listen to this quote from this source material we're looking at. It really puts it into perspective. We're not talking about a minor inconvenience here. We are talking about a condition that is a massive problem for the most vulnerable people. We're talking young kids and pregnant women in these parts of the world. So why is it so much worse there? Well, it's basically a perfect storm of factors. It's almost never just one thing. You've got widespread malnutrition, especially not enough iron. Then you layer on top of that infectious diseases like malaria, which literally destroys red blood cells. You've got parasites like hookworm causing constant low-level blood loss. Then you add things like HIV and inherited conditions like sickle cell disease into the mix, and you end up with this tangled web of causes that makes figuring it out and treating it incredibly, incredibly difficult. So when you step back, you see anemia isn't really one single disease. It's more like a critical clue that something else, something deeper is going on. This mystery has so many different culprits, from a simple gap in your diet all the way to a complex infectious disease. All the evidence we need is right there in our own blood. So the real question we have to ask is, are we looking closely enough to solve this case for every single person everywhere in the world? Thanks for joining me on this one.